All right.
Welcome to Minnesota. We've got the Twin Cities, the Mayo Clinic, more than 10,000 lakes, and the source of the Mississippi River. Hi, I'm Jim Peacock, and I'm an epidemiologist with the Heart Disease and Stroke Prevention Unit here at the Minnesota Department of Health. And what I just drew for you on this whiteboard is how we used to do GIS in the Chronic Disease Division here at MDH. So I'm happy to say that now that we've gone through CDC and CHI's GIS training program, I've been able to accumulate what I like to call is a binder full of maps. So we're just going to answer a couple of questions for you today about how we've been able to use GIS since the training program. And really, I can't say that we've integrated GIS into everything that we've done, but we do make a concerted effort to have GIS be part of every discussion as we're talking about chronic disease and its risk factors. It's been exceptionally useful in helping us explain the burden of chronic disease and its risk factors, both internally to health department staff, but also externally to our stakeholders and partners around the state. It's been very useful in helping us to evaluate the reach and impact of the programs that we implement that target chronic disease and its risk factors. Some of those things are things that show up in reports that we send back to you at CDC. And then finally, and most obviously, maps are a great way to display data, and they help engage a whole new community of people into discussing the issues that you're representing on those maps. So in this binder full of maps, as I like to call it, I put together a series of maps that I view as having been very useful for various programs here at MDH, incorporated into reports and so on. But it's hard for me to identify a favorite map in particular. Some of these maps have been put together as a way to establish both the reach and impact of programs that we've implemented. Some of them have been put together in order to provide a graphical representation of the demographics of the state. Some of them have been put together in order to explore the possibility of combining different data sets, being able to understand how mortality is impacted by clinical performance on quality measures related to chronic disease. And finally, some maps have been put together to help assist other programs within MDH, not just the heart disease and stroke program or the diabetes or the environmental epi program, but programs that are also working hard on risk factors that we all share in common. So I'll flip through a couple of more of these pages here. And finally, I think, although maybe not my favorite map, a map that we've really spent a lot of time on and was an impetus for us seeking this training program, was this final map, Drive Times to Primary Stroke Centers in Minnesota. We knew early on that there was a large expanse of the state that is rural, that is lightly populated, not necessarily sparsely, but the folks that were far away from the primary stroke centers, hospitals that could acutely treat emergent stroke patients. And this map demonstrates that. We used network analysts in order to establish the 30 and 60-minute drive times around the primary stroke centers in the state and on our borders. And we were able to identify these huge wide expanses of the state where there are individuals living represented by these black dots. And we identified that 25% of our state's population was outside that 1-hour drive time. This really galvanized a statewide steering committee which consisted of clinical practitioners, other stakeholders, and MDH officials to raise the bar and increase the visibility of stroke as an important issue in the state. And we're currently heavily embedded in the process of trying to make rules changes to create a coordinated statewide acute stroke system. So with that, this is just an example of how we're using GIS now, an example of what we might call a favorite map, and how that map has been used to communicate effectively with our constituencies. I want to say again that we at MDH are very grateful for CHI and CDC in terms of sponsoring this GIS training program. I think the most useful thing for us as we were going through the program really was being able to interact with professionals from other state health departments, to understand the difficulties that they have, how they've overcome those barriers, and to be able to share the successes that we've had here. It's been a great experience to learn. Thanks again.